So we're here today to celebrate with MapRX the creation of Medicare Part D, which has really provided life-saving, life-improving medicines for our seniors and those with disabilities.
Part D was a big change for Medicare. It not only provided the first coverage for prescription drugs, it provided it in a new way. Setting up a program like that took a lot of work, a lot of collaboration with patient advocates, with healthcare organizations, with pharmacists, with other health professionals.
We all need access to medications, the right medications at a cost we can afford. So we do work together, we have a common agenda, and I think it's, power in numbers.
So one of the things that we've been advocating for is to cap out-of-pocket costs in Part D so that patients can have a better idea of what they can expect to plan for in terms of their cost. I think one of the biggest challenges that cancer patients face is that in addition to battling a life-threatening disease, they really have absolutely no idea what their medical costs will be.
I work with lupus patients who take on average 8 medications a day. And many of these are low-income individuals who, if they didn't have Part D, they'd be in the hospital every couple of weeks.
Medicare Part D makes it possible for me, having lupus, to do anything I want, to exercise, which makes me healthier, to travel, which makes me happier, spend time with my grandchildren. All of those things are possible having the medications you need.
Many people, I think, take this for granted, that it was something that was just kind of created a long time ago and didn't understand the politics behind it. And as our current leadership tries to save money and tinker with things, it's very important for us to save things that are working and see how we can improve them over time.
We face a coming cliff because the Affordable Care Act actually filled the donut hole gradually over time, and that's worked out pretty well. But because the second part of the Affordable Care Act was done through a process called budget reconciliation, and there's a 10-year budget window, and people could face as high as $1,500 in extra out-of-pocket costs in 2020 when that budget reconciliation window expires. So Congress needs to act on that to protect beneficiaries.
I think there's 2 choices that we in the community can make. We can say, great success, it's working well, or we can say, let's take a fresh look at how different pieces are working.
I think the promise is still mainly in the future. There's so much more we can do, and Medicare Part D is going to be a critical part of encouraging those developments and bringing them to the people who really can benefit from them.
When I think about the tens of millions of people who are benefiting, all of us believe that's important, but none of us are resting on our laurels. There is more work to do.